Hi, everyone. It's always good to see more and more people attending talks like these, especially because it's so important to know about mental health now that it has become such a visible topic in our everyday lives, right? More and more of us are opening up about our mental health and our struggles, which makes it easier for others to come forth as well. So it's good to know that you all are here to perhaps learn about suicide and suicide prevention and maybe use what you see today for yourself or loved ones in your life. Suicide, it's such an important topic to talk about, but unfortunately, there's still some taboo and myths about it because of just lack of knowledge and information. And it's really hard to get this info if you're not even aware that this is something deeper than just a mental breakdown. Even saying the word suicide may feel uncomfortable for some of you too. I believe that there are a lot of negative connotations of suicide in our religions and in the media as well. So today we want to help you gain awareness of what suicide is, how it happens and why, and what you can do to either seek help for yourself or support others who may be going through this struggle. So first and foremost, when we say the word suicide, it means the act or the completion of the act of ending one's life through lethal means. But the risk of completing suicide can be progressive, ranging from no risk at all to mild risk and all the way up to highly severe risk. In the mild risk or the earlier stages, people would usually have suicidal thoughts or ideations, which both mean the same thing, where they think about ending their life, going to sleep and never waking up, or, actively think about killing themselves through some means. This could range from a small thought a few times a day or an extremely intrusive thought that makes it hard to concentrate on anything else but giving in to that idea. At this stage, most of those who have these thoughts very much do not want to end their life, but the existence of these thoughts can be very, very hard to manage. They could also then have suicidal intentions, where the thoughts and feelings they've been having becomes clearer as they start really wanting to end their life. Again, this could range from mild to very strong. And lastly, something that would indicate a much higher risk is when someone has suicidal plans. They have thought up how they could end their life. They may have acquired the means to do so, like a rope or pills, and decided when and where to do it. Suicide is such a complex topic because while many people may experience only suicidal thoughts and ideations, those who make a plan and attempt to complete suicide could not be helped until it is too late. So I want to dive deeper and share with you all about what could be one of the major factors of suicidality, which is hopelessness. The hopelessness theory of suicidality helps to explain why some people might see suicide as their only option, no matter the circumstances. It states that people who are highly suicidal tend to have a more negative and pessimistic expectation of how things will turn out, either an event, a project, or their future, and they believe that there is absolutely nothing they can do to change this predicted outcome. They fall into a sense of hopelessness and feel like they are drowning with no way out. This leads them to look at suicide as the only viable option, believing that not only is it a means to end their pain and suffering, but also because they believe that other people in their life may benefit from their absence, such as feeling less burdened by their existence and worthlessness. So suicide is really the only option that these people can see because of this continuous and overwhelming feeling of hopelessness. It would be difficult to determine exactly who is more likely to feel this sense of hopelessness that might lead to suicidal thoughts and intentions without looking at the risk factors that they may have. Our risk and protective factors, as you can see here, pave the way for our resilience, which includes finding hope in what feels like a hopeless situation. Our risk and protective factors also provide us an idea of how easy or difficult it would be to escape the cycle of hopelessness and depression, or suicidality. So let's take a look at some of the risk and protective factors that we may have. We have all these factors that can be categorized according to the different levels of individual, relationships, community, and societal levels. Firstly, for the risk factors, at the individual levels, they can look like this. One of the biggest indicators of suicidality will be a previous suicide attempt, which makes it much more likely for them to complete a successful suicide the next time they try. There is also an existing diagnosis of depression or other mental health disorder, such as anxiety, PTSD, or psychosis, that would contribute to a higher likelihood of developing suicidal tendencies. This is a notable factor, as most people believe that suicide only happens when someone's depressed. There are many, many cases where suicide is attempted or completed when someone is in a manic or psychotic state as well, which would be a more impulsive decision because of the symptoms they face in that moment, not just depression. People with serious illnesses such as cancer or other lifelong ailments or chronic pain could be at a higher risk because of how hopeless they may feel in their condition, especially if there seems to be no treatment to cure their ailments permanently. For those without existing mental health or physical health conditions, it is common that a sudden change, such as a loss of employment or financial stability, like losing all their life savings in a scam, this could be a potential risk factor to opting out of their perceived hopelessness through suicide. Substance misuse, abuse, and addiction are also on this list due to the varied states that one goes through while addicted or using substances, such as withdrawals, negative spirals of feeling trapped in their addiction, as well as impulsive decision-making when high, such as in a manic or psychotic episode. And those who have experienced significant trauma, either recently or distally in the past, spanning from childhood trauma to abuse as an adult, could see suicide as the only option as well, to either escape their situation or to escape the lingering traumatic memories and flashbacks. This also speaks true when we look at the relationship level of risk factors, where they might be experiencing or have experienced terrible and abusive relationships, which have been traumatic, and suicide is seen as their only option. This can include experiences of being bullied, being in a toxic and manipulative relationship, and even being socially isolated. A family history of their loved ones struggling with suicidal behaviors or have attempted or completed suicide is also a risk factor, as they might have a genetic inheritance of a mental health disorder which might lead to suicide, or the grief and trauma of a loved one passing away through the means of suicide is too overwhelming to manage, and this person then gets pulled into a spiral of loss and hopelessness. Then at the community level, it's common to see that both mental health disorders and suicidality are at more severe levels in the marginalized, such as minority races and religions in that region or country, LGBTQ community, and the disabled and neurologically impaired. This is because their identities, ethnicities, and abilities are being discriminated against, which results in risk factors at both the individual and relationship level, such as isolation, socially, or loss of employment because they're of a certain race. At the societal level, there is an alarming risk factor, which basically translates to we don't know enough. The awareness about suicide and mental health is not at the level where it would result in the reduction of suicidality rates, but rather can increase these rates because the lack of awareness can result in discrimination and will trickle down to the other levels of community, relationship, and individual levels too. The more we are aware and informed about any topic, the more we can do about it. The media also can portray suicide and suicidal behaviors like self-harm in a discriminatory and judgmental way. And it's not a surprise that after the portrayal of suicide in a TV show that was streamed globally, some of you may know what I'm talking about, there was an alarming spike of suicide attempts and successful suicide in the overall teenage population worldwide. What I find more unhelpful is that the general public's reaction to this was again quite judgmental and seemed to have perceived these deaths or attempts as just attention-seeking behavior. Suicide is a very, very serious matter, and it does all of us well to pay attention when someone is contemplating it, no matter what their life circumstances are. These are the more prominent risk factors that exist among those who are highly likely to have suicidal behaviors. And I hope so far me going through this list has given you an idea of how you may recognize and empathize with someone who's having suicidal thoughts and ideations. I won't go too much into detail for the protective factors you can see on the right side, as most are the opposite of the risk factors presented here. But let me touch on a few that can be applied to what you yourself can start doing today. On the individual level, if you find yourself struggling with suicidal thoughts, intentions, or even making plans, I hope you know that you're not alone and that support is always there for you. There are a lot of helpful resources which are available to you, and so I hope that you can at least reach out to one today. Professional mental health support such as counseling, medication, or psychotherapy has been proven to help as a protective factor as well. As someone who is not experiencing suicidal tendencies, you can provide support at the relationship level by supporting someone you know who may be going through this. If you notice that a friend or family member has recently started distancing themselves without reason, or might have changed their behavioral pattern, a common one is when they start getting rid of their material possessions or writing letters to tell people in their lives that they may not be around anymore. It may be helpful to reach out to them. They might not have a strong protective factor in terms of the relationship level, or they might not even believe that they have good relationship support. So it could help for you to reach out to them first and prove them otherwise. At the community level, protective factors could be good social connectedness in their community, such as at school, college, university, work, or other social communities such as faith and religion, hobbies, and so much more. This means that they have good relationships with the people in their communities and do not feel isolated even when they're surrounded by others. An additional protective factor at the community level is the availability, accessibility, and peer acceptance to seek support with affordable healthcare, especially for mental health. What we can all do is begin supporting people we know who have been using or want to start using mental health services, and by sharing any resources that we know with the people in our lives. And lastly, at the societal level, reducing access to lethal means of suicide, such as controlled medication or guns, could be helpful, as it's shown that in these countries with higher restrictions on these, the associated suicides are at a lower rate. But the most important thing is what you are doing right now, sitting here, learning. With higher awareness about suicide and mental health, we can already start reaching out to those who need support, or to be accepting of those who are struggling with this themselves. This reduces judgment, discrimination, and social isolation of people who may be already contemplating suicide, which of course serves as a protective factor against complete hopelessness and later suicide attempts. Throughout it all, just the knowledge of these factors can help you gain a better understanding about the topic of suicide and how hopelessness affects the chances that someone might be stuck in a cycle of suicidality. If you want to know more about these and what you can do, please share your questions later, but thank you so much.
Thank you so much, everybody, for taking the time to participate in this webinar today. I resonate with what Amanda said, that just the efforts that we're making to be a little bit more cognizant as to what's going on is a huge first step in helping those who struggle with this issue. My area of specialty is in child and adolescent psychology, and so I thought I'd take a bit of time today to just touch a little bit on that particular issue, because I do feel that one of the misconceptions that currently exists is that kids don't hurt themselves and that suicide is not something that happens to children. And so that's kind of what I wanted to talk about today. So we'll jump into the really short slides that I have, just kind of going on to it. So based on the information that we currently have, and I have to kind of preface this little slide that I've put together with the fact that there isn't very much information looking at how it impacts children. Absolutely, the statistics do seem to show that it is a lot less. It's occurring at a lot less of a rate in comparison to adults. But the statistics that we have don't do a very good job at giving us a bigger picture, but we'll give you kind of what we have. Yep. So this was based on statistics that were provided by the American Academy of Child and Adolescent Psychiatry. It is the second leading cause of death in children and adolescents between the ages of 15 and 24, most of which have been diagnosed with a significant mental health disorder. But that being said, there are still a population of individuals who do not have a psychiatric diagnosis who successfully took their own life. Among the teenage community, suicide attempts are often associated with feelings of stress, self-doubt, whether it's coming from the familial side or it's coming from peer pressure or schools or relationships. There is a pressure to succeed. So we do see that kind of acting as a contributing factor, financial uncertainty, disappointment, loss, just to name a few. So there are often elements in the teen's life, which very much like what Amanda was saying, that makes them feel like taking their own life or committing suicide is the only option available by way of ending their suffering and easing the burden. And that's something that I find when working with young people is a very, very big statement that I hear being discussed, where they feel like they are a burden to their family members. And we'll touch on a little bit later as to how that kind of comes about. But essentially, that is something that I hear quite often, where they feel that ending their life is actually easing the burden or is something that they should do because they love their family members. If we look at children, however, so younger children, suicide attempts are often something that is extremely impulsive. So it happens on the heels of something that could have happened at school, or an argument or an altercation that they had with their mom and dad at home. It is generally not something that is as thought out and planned as you would see in the adolescent community. So with younger children, it is something that usually is, again, very impulsive. So if we can move on. The statistics that we do have in Malaysia, as I mentioned before, is a little bit limited. But what we do know, if we click again, between the dates of January 2019 and May 2021, so sort of at the start of the COVID-19, or sorry, prior to the COVID-19 pandemic and sort of just a year in, there were 1,708 cases that were recorded by PDRM. Now, when it comes to these statistics, we within the mental health community do very much feel that it is not a true representation of what is really happening out in the world, because these cases would need to be reported to PDRM, and these would need to be, this is based on statistics that they were able to track. Up until recently, suicide was criminalized in this country. It has wonderfully been reversed now, but up until very recently, individuals who had self-harmed or those who had lost family members due to suicide were very, very afraid with regards to that information coming out due to fear of prosecution. So we do see quite a few family members, and I've had the unfortunate experience of having worked with individuals who've lost family members who tried very, very hard to make sure that that information did not come out and that PDRM was not notified. So that being said, we do believe that this statistic is a little bit skewed. Of that number, 872 were minors, so under the age of 18. Right. So again, this is based on what was reported. Of that number, 51% of that total of 1,708 earlier were children between the ages of 15 and 18. So as we can see, it is a majority, right? It focuses on sort of that age demographic. Some statistics don't even attempt to kind of separate between children and adolescents, but this is sort of what we have currently. Since the COVID-19 pandemic began, the daily number of cases reported had about doubled in comparison to what PDRM was receiving in 2019 and in 2018. So there was a sharp increase in cases. There was a statistic that I read where a young person, so someone under the age of 18, PDRM was receiving something like 3 reports a day of individuals, of young people committing suicide since the pandemic began. So the pandemic was absolutely a major factor in the sharp increase of children and adolescents globally successfully committing suicide. And that's because a lot of them were isolated. A lot of them were, like Amanda said, there were a lot of these contributing factors which they were living with that they could no longer escape because they were all in lockdown. So we were seeing a sharp increase in teenagers taking their own life and also with regards to self-harm. Now, what makes it such a challenge or something that's a bit of a unique situation is that you are dealing with a demographic of individuals, unlike adults, who might not present with the same red flags as what Amanda had described earlier. And a big part of that comes from the fact that depending on how old they are, we're looking at neurodevelopmental immaturities, right? So you have children who, from a hardware perspective, do not yet have the skills to be able to articulate or to process things the same way that adults do. And so we see kind of these risk factors or these red flags appearing in a slightly different way with children as they do with adults. So when we talk, for example, when, like as Amanda said, individuals writing letters to say goodbye to their loved ones, some parents would be looking out for something like that, for example, and then finding themselves at a loss because that's not something that their child or the young person that they know had done. So what we normally advise with adults who are caring for a young individual who has concerns about their mental health. This isn't just specific to suicidality, but also just with regards to anything related to their mental health. The one thing that we're advising parents to look for is change. Very simply, look for changes in how your child is conducting themselves in comparison to maybe just even 2 months or a month before, and see whether there's anything that's a little bit alarming. So some of the things are eating and sleeping habits. So is your child now very, very particular over what they eat? They're not eating as much as before. Are they binging, for example? Are they all of a sudden finding it very difficult to sleep? So insomnia, or the reverse, sleeping way too much, what we call hypersomnia. So if we're looking at these changes in their eating and sleeping, that's something that's noteworthy. Right? So a lot of parents tend to ignore this, especially when you have teenagers involved, where staying up all night and kind of skipping meals or eating junk food is something that's quite normal. And so parents just kind of close an eye to it. But if you're seeing a child have these very drastic changes to the point where it's affecting their appearance, for example, or their health, then definitely something to keep an eye out for. The next change to look at is socialization. So as Amanda mentioned, you see a pattern of withdrawal, not just with individuals with depression, but also with anxiety, bipolar disorder, all of these issues with regards to how they interact with the people around them. So their family members, their friends, their partners. If it's something that you're noticing, they're not socializing in the same way. They're kind of preferring to stay indoors, not really wanting to engage, not wanting to sit around the table and have a chat with people, then that is something that you should take note of, especially if it's something that they used to enjoy doing before. If your child was quite social, but now you can't really get them to go outside, then that is something to take note of. The next change is with regards to personal hygiene. So individuals who struggle with depression, actually with regards to anything with regards to their mental health, they don't really seem to think that their physical appearance is important, especially when it comes to hygiene, because there's so many things that they're carrying on their plate that how they present themselves is the absolute last thing on the docket. I've even had some clients tell me that it's because they feel that they have so many things to focus on and so many things that they're feeling that it's almost how they appear, how they present themselves is almost sort of a visible representation of how they're feeling. So regardless of kind of what their association is, you do see these young people struggling with personal hygiene. So they struggle with baths, combing their hair, not really wanting to be very well kept. So that's something to look out for. The next is what I call physical health, but ultimately what I meant is you'd see an increase in complaints with regards to physical symptoms. So things like stomach aches, headaches, difficulty breathing, things like that. But ultimately, when they do get it checked out, doctors can't often find a medical cause or a biological explanation for why these things are taking place. So we would see an increase in what we call psychosomatic symptoms. So symptoms that have a psychological element to it. You would see children report an increase of that. And they would often use those things as a reason. I'm not going to call it as a excuse, but as a reason to avoid going to school, to avoid hanging out with friends, to avoid doing things because they feel unwell. The other thing I said to look out for in changes is with regards to their speech pattern and their mood state. So a child who's generally quite happy, having more sad days than happy days. Children who are generally quite, find joy in certain things and quite excited about certain activities, now finding it very difficult to do so. Changes in speech patterns, keep an eye out for if they're starting to be quite negative, quite pessimistic, cynical when it comes to the things that's happening around them. Things like, nobody likes me, nobody wants to be my friend, I'm not good at anything, I'm fat, I'm unattractive. Just being very negative over how, of what they're saying is something to take note of. This is something I feel that a lot of adults tend to sweep under the rug as well. But it can be a very good indication or a very big indication that your child's what I call internal narratives, the sort of the thoughts and the voices that we all as individuals have, our gut instincts, are starting to take a bit of a negative turn. And I believe that when this internal narrative starts telling you negative things, it is very, very easy for you to fall into that spiral. And then finally, because we're looking at a younger demographic, look for changes in their academic performance. So if a child who need not be a straight A student, but just overall performing poorly in comparison to what they were doing before, missing deadlines, not wanting to do homework, you're getting reports from teachers and not wanting to participate in class, or they're getting into fights with other kids, anything that's happening at school that's indicating that you have a very different child on your hands is a red flag. So overall, the one word I tell parents to look out for is change. No two kids will present the same. The changes will not be the same in any of the clients that I've worked with. So I tell parents that if your child is different and is presenting with changes as compared to how they were before, it's something to take note of and something to potentially bring up. Looking back as to why it is that sometimes kids would hurt themselves or attempt suicide because they feel like they're burdening their parents. Unfortunately, a lot of that is related to the language that's being used and in the home or around them when it comes to mental health and when it comes to their behaviors, right? So one of the things that I hear very commonly is things that, what do you have to be upset about? You've got a roof over your head. There are kids in other countries who don't have even enough food to eat. You're not grateful. You need to be more grateful. You're not grateful enough. There's a lot of this comparison that happens in our community and in our society that makes kids feel like what they're feeling is invalid, or what they're feeling is they don't have a right to feel what they feel because someone else has it a lot worse. And that's sort of the narrative that's been ingrained in a lot of the minds of Asian children, I feel. And so when we talk about suicide with kids, if you have concerns, these are just some of the best practices that I find, and that's also been advised by many suicide prevention associations around the world. The first thing is, I would say, leave the judgment behind. Kids are extremely receptive to the temperature in the room. And so if they get the vibe that what they're saying seems trivial to you, or if you are uncomfortable over having to have this conversation with them, or if you feel that it's something that should not be discussed, and a lot of parents do admit that to me, where they feel that suicide is something that is difficult for them to speak about because it goes against their belief system, it goes against their religion, it's something that they don't understand. They feel that it's something quite what was the word that one of my clients had said? It's very much a new generation problem, right? Because of, the fact that it's so discussed in the media now. And so because of that, it's a new age problem that they didn't have to deal with when they were growing up. There's a lot of this judgment coming from their own, or when I say they, I mean parents' personal experiences with suicide, suicidality, and conversations about suicide. And so when they go into this conversation with their child, there is a little bit of judgment. I say a little bit, but often a lot of judgment that comes into the conversation. And your child is going to be very, very cognizant of that. And so when you are coming in with a little bit of judgment there, the child is going to feel like it's not a safe space for them to discuss it, because their thoughts and feelings are going to be poo-pooed on or trivialized. And so you do start to see that. So if you're going to have a conversation with a child about suicidal behavior, I would say ensure that you are going into it with an open mind, and that you are not going to be bringing your own personal feelings into the conversation. And that it's more about trying to understand where they are coming from and why they are feeling the way that they're feeling. And just not kind of use any type of, and that's sort of the last point, any type of language that could indicate that they're being judged for it, right? So that's the first bubble there. The second one is don't rush. Undoubtedly, it is a very difficult conversation to have. And so what I find is, what do all human beings do when they're in a position of discomfort? They try to get through it as quickly as possible, rip off the Band-Aid, if you will. But it's kind of the opposite of what we want to do. When you rush through a conversation as important or as significant or as, difficult as this, you could potentially communicate the message to the child that either this topic is not important to you, and so you just kind of want to get through it. But also, again, when we're looking at younger children, they will likely lack the language skills. And when I say language skills, I don't mean that they can't speak, but rather they don't have the vocabulary, or even the ability to properly articulate how they're feeling, right? And that's not because they have a speech issue, but just if we're looking at neurological development again. And so they need the time. They need to be able to be given the time to connect the dots, if you will. And so if you're trying to rush them through it because you have other pressing matters or because it makes you uncomfortable, then you're just going to make them feel like they can't speak up yet again. So don't rush. I've told parents before, if you have a difficult day ahead of you, if you have a very important meeting that you need to get to, then I would much rather you find the time to have this conversation with your child and not just try to slot it in, right? Because the consequences of rushing is quite damaging. The next thing is to be aware. So try to kind of understand before you have this conversation, just using sort of your ability to observe and kind of how well you know your child. What type of mood and emotional state is your child in? Is this going to be a effective conversation, or is your child in a state or in a position where they're quite closed off and they're probably not going to say anything anyway? So be quite mindful of their emotional state. If they are comfortable or willing to have the conversation, then you also need to monitor that emotional state throughout the duration of your conversation so that you can be given some insight into whether or not you're going down the right path, whether or not there are things that you're saying that's hitting the nail on the head, or whether it's making them feel very uncomfortable. So being mindful of kind of how they are presenting themselves is extremely important. And that's something that we also practice in the clinic as well, to be able to gauge whether or not what you're saying is affecting the person you're speaking to in a negative way. But that being said, that brings me to the next bubble, which is nonverbal cues. With children, body language is probably your biggest tool in determining whether or not your child is uncomfortable or whether or not you've said something that has sort of taken a bit of a negative turn. Look for things like their posture. So are they now all of a sudden very fascinated with the color of the wallpaper? They're not really wanting to look at you in the face anymore. Have they started to fidget a lot more than they were at the start of the conversation? Even just how they're angled towards you. So when you were talking, if you were looking face sort of like directly at each other, but then as the conversation progressed, you're kind of seeing the child kind of angle themselves away from you. You're seeing a little bit more of what I call kind of like the fetal position kick in. So they're kind of curled in, their arms are kind of crossed in front of their chest. It's a very protective body posture. These are all things that indicate that the person you're speaking to is uncomfortable. And so children might not be comfortable saying it out loud because if you're mom and dad, they don't want to get into trouble. They don't want you to yell at them. So they will probably try to say everything is fine, but the body language doesn't lie. And so if you're seeing changes in their body language, so if they were sitting, but then now they're walking and pacing, if they're, like I said, were previously angled towards you, but now they're angled away, they don't want to look at you, their tone of voice voice or maybe just what they're saying has changed. So maybe they were quite conversant in the beginning, but then now they're very monosyllabic and it's sort of like grunts and noises rather than yes or no. If you're seeing a lot of this non-verbal cues or these things changing with regards to their body language, then that's a sign that the conversation isn't going well or they're not ready to speak. So you kind of have to keep your eyes open as much as your ears open when you're having this chat with children. And finally, use appropriate language. You want to be clear and direct. As difficult and uncomfortable as the conversation is going to be, you do not want to kind of beat around the bush. You want to be able to understand whether or not the risk of a suicide attempt is valid or real, is what I meant. You want to understand, as Amanda said, whether plans have been made. How long has this been going on? Do they understand what's contributing to the thoughts in their mind that they shouldn't be around anymore? You need to be able to be very clear with them over this because you do not want to run the risk of things kind of going missing in between and to potentially miss a very big red flag. And so use very clear and direct language and refrain from any phrases that could potentially make your child feel like you're chastising them, that you're condemning them, or that they need to be feeling guilty for the fact that they're in this position. Because I promise you that it's not something that they've asked for. And so these are just some of the best practices that I advise parents when they've identified certain red flags or certain things that they are concerned about around the topic of suicide or anything related to mental health. So that's kind of what I've prepared for everybody today. I think that's the last slide. Yes, that is. And so I've just prepared my email address right at the bottom there. If anybody has any questions they would like to send to me directly. But I look forward to answering anybody else's questions. And that's the end of my presentation. Thank you so much.